Welcome to Combos from the Couch by LifeStance Health, where leading mental health professionals help guide you on your journey to a healthier, more fulfilling life. Hello, everyone, and welcome to another episode of Combos from the Couch. I'm Nicolette Lianza, and joining me today is therapist Nicholas Marchand, and we'll be talking about the therapy expectations gap, which is the growing mismatch between what clients expect therapy to be, largely shaped by social media and therapy influencer culture, and what the actual work looks like. So, welcome, Nick. Great to have you on. Excited to talk about this topic too.
Yeah, hi, Nicolette. Thank
Yeah.
you so much for having me.
Yes, thank you. So, as we dive in, tell us a little bit about yourself and what led you to become a therapist.
So, my name is Nicholas Marchand. I am a licensed clinical professional counselor, also a national certified counselor. I graduated in 2018 with a master's in clinical mental health counseling. What led me to become a therapist was major life changes and events that occurred after high school. And I was in the transition of corporate job and sales and was unsure of what I wanted to do as a career and figuring out that career identity. So one of my friends had suggested me to go back to school and get my master's degree to become a counselor, because during that time I was already helping individuals within the community. And for me, it just made sense for that career shift. So that's when I decided to enter back into grad school and join the counseling field.
Great. Wonderful. So, let's start by having me throw out the question of what do you see as the most common misconception clients bring into the first therapy session with you?
When thinking about this question, there was four misconceptions that I came up with. And so I would say clients don't always walk in to their first therapy session with a blank slate. There are times that clients can carry assumptions, and a lot of those assumptions sometimes are shaped by social media or their past experiences, and sometimes there's some anticipatory anxiety about the unknown. So the first misconception that I would say would be that the therapist will figure them out and deliver a clear answer and solution right away. And so I would say that therapy is a collaborative experience and exploratory. So you're building a therapeutic alliance essentially, and that takes time. Therapists, we're not here to diagnose your entire life in one session or hand them like a fixed plan after the first initial therapy intake. So I would say clients work with us to understand patterns over time. That'd be the first misconception. The second misconception would be that you don't need to present your whole story in a perfect or organized way. A lot of times people feel pressured to explain everything clearly or to get it right, when in fact the first session is often messy, it's nonlinear, and that's completely expected. Like many times clients will come in after their first therapy intake or during the first therapy intake, and they would say, I feel like I'm just like going all over the place. And essentially that's great. You're throwing a bunch of things on the wall, and the therapist as therapist will pick those golden nuggets out and maybe come back to those later. It's non-linear, and that's completely expected. So we're trained to help structure the conversation, and there's a beginning and a middle and an end to the therapeutic process.
Yeah.
The next misconception I would say is the third one would be that clients will assume that they'll be judged when discussing sensitive topics. Completely expected. We are human, and we all judge, right? We are a lot of that judgment and can come from the stigma around mental health or prior negative experiences. So I would say in practice, our aim as therapists is to create a non-judgment, and though that it can take time for that to actually feel real. And then the last the last misconception I would say is that therapy only works when you're in crisis, or that an individual's problems aren't serious enough. So that tends to lead people to minimize their own experiences. And therapy is just as appropriate for ongoing stress, relationship issues, or personal growth as it is for acute stress. And some people can expect emotional relief after one session. And so while that session can be validating, meaningful change happens over time. Say,
My gosh, you bring up those are great observations of what misconceptions you see your clients bring. I see many of those as well. Another one that I'll see is this seeming to be assumption that I'm going to tell them what to do when it's really, as you had mentioned in one of your misconceptions of it's exploratory. You're working together. It's a
mhm,
team approach. Have you seen that as well? They're trying to have you maybe tell them what to do?
most of the time, right?
Yeah.
And in some ways, as a therapist, it's do I need to be telling them, giving them guidance? But going back to using the clinical judgment, it's and my theory is I believe that the client's the expert of their own
Mhm.
life. So essentially, I tell clients I don't solve problems, I help solve problems or
Love that.
issues. Mhm.
Yeah.
And again, using problems is just a word that has not been operationalized and that needs to be operationalized through the client's lens,
Yeah.
essentially.
Gosh, I agree. So, how can social media shape what clients expect from therapy, and how does that collide with the actual work?
Yeah, the unofficial therapist, social media. So I would say it has become kind of the unofficial therapist for many people, and that can naturally shape people's expectations and sometimes in helpful ways, but it doesn't always match what therapy actually involves. And one of the things is that one of the big influences is that therapy is how it's packaged online through Instagram or TikTok, for instance. So those platforms reward short and punchy, emotional, resonant content, right? So during that time, many people are exposed to many simplified ideas, such as like cutting off toxic people or set boundaries that or heal your inner child in 30 or 60-second clips. And and I'm not saying that those ideas are wrong, but it strips away like the nuance and the context and the hard work actually required to apply them in real life. And so therapy, what it does is it slows things down, right? As humans, we essentially are looking for instant gratification. And
Yes.
what is a good practice is to try to strive for that delayed gratification. And this kind of goes back to a misconception is that clients may expect quick clarity or decisive answers like we were
Mhm.
talking about. And like therapy helps people sit through the ambiguity, and we explore patterns, there's contradictions and resistance over time.
Nick, you're
Mhm.
doing a great job really trying to expand this out to help people understand the difference between these 30-second clips and 10, 20, 30-second clips of really
Mhm.
what therapy is and expanding it out and really, really exploring it more, exploring the patterns and all the things, and that you're not going to get a quick fix. Right. I
Sure,
appreciate that.
absolutely. Another mismatch may be like how social media frames therapists online themselves, right? So
Mm.
they can present as highly articulate, always attuned, and consistently validating. When in reality, therapy can include misunderstandings,
Yeah.
moments of tension, and repair also.
Yeah.
And so
Yeah.
sitting
Very
through that
true.
uncomfortability helps individuals grow. And real therapists challenge clients, or we don't respond correctly all the time or
Mhm.
perfectly respond
Right. We're,
perfectly.
we're human too, right?
We are. Yeah.
So, what happens when a client arrives at your office with a TikTok inspired self diagnosis? How do you navigate that?
I would say that there is also an issue of the self-diagnosis where social media has popularized mental
Mhm,
health language. So terms like trauma or narcissist,
mhm,
attachment style, gaslighting.
mhm.
It can be empowering, but it also can lead clients to arrive with fixed labels or narratives
Yeah.
about themselves or others. And I believe
Mhm,
working with humans in therapy allows for that process to happen naturally. And clinical diagnosis are used just as a framework or a tool to help guide our clinical decision making, right? So it can
mhm.
evolve over time, and individuals are so much more than major depressive disorder, generalized
Right.
anxiety disorder,
Right.
post-traumatic stress disorder. We are human, and I believe that takes the human element out of it, because humans are so much more than that.
Yeah.
So a lot of times labels need to be unpacked, I would say,
Yes.
questioned or reframed. And sometimes that can feel invalidating. There's a lot of times I do have clients that, and I say that they're the expert of their lives. And even more recently, they've come back and have questioned maybe not their diagnosis, but just the way they're feeling. And they're constantly updating on symptoms, things that may be experiencing. And in some way, clients may need to hear, maybe there's not anything wrong with you.
Right.
Maybe this is just what you're going through. That's okay too. On the other hand, it is extremely helpful sometimes as a therapist to hear this from clients, because when an individual is being vulnerable, sharing about themselves in what's happening in their own world, maybe sometimes that they haven't really shared this with anyone else, right? And so it helps inform our clinical judgment, our assessment of what's actually happening, and it brings a little bit more understanding of what's happening in the client's world to help assess and provide a correct or proper clinical diagnosis of what's actually happening.
Got you. I know on my end, times what I'm doing, if someone's coming in saying, hey, I saw a few Instagram reels or TikToks that show this aspect per se of OCD, and I think I'm OCD. So a lot of what I'm doing is just educating, okay, this is the criteria for OCD. That little clip of what you were seeing as a TikTok where someone just wanted everything just perfectly straight and nice on their desk doesn't necessarily mean that's full OCD. So it's a lot of it is educating what we're doing as well to help them understand what there might be a misrepresentation of OCD, ADHD being on the spectrum via social media as well.
Absolutely. And I think it's which brings to mind what I've learned in grad school through seasoned adjunct professors who have been in this field for a while, who have shared. It's not always helpful to share with clients their diagnosis, right? Or to go through that DSM with them, to share with them the diagnosis that they have, because sometimes, they may cause more implications with them, right? And so I think part of that therapeutic process is finding you have to trust the doctors or medical professionals who are trained and licensed in their field, essentially.
And people are more than their diagnoses. We don't want a full identity of if maybe a person is diagnosed with bipolar disorder. I'm just bipolar. You're way more than your symptoms related to bipolar disorder. So it is understanding we are humans and we're complicated and we're more than just a diagnosis or a label.
Absolutely.
Definitely, for sure. Any other insights you'd like to share?
Social media kind of promotes a consumable healing. So you can scroll and save and feel like understood for the moment. And therapy and therapists ask for something more demanding. So sustained attention, vulnerability, and behavioral change outside of session. Right. And the shift from passive consumption to active participation is where many expectations collide with reality.
Very true. Nick, thank you. Thank you for having this conversation with me. Very important, especially in this day and age of social media and artificial intelligence and all the things. We really want to make sure we're educating people on what therapy actually is. So thank you again. I'd love to have you back on.
Thank you so much. You're welcome.
I'd also like to thank the team behind the podcast, Jason Clayton and Juliana Wooden. Thank you for listening to Convos from the Couch. Take care, everyone.